tell you about the e-learning tools and community practice for refugee mental health, something that I'd like to shorten by calling it just the Refugee Mental Health Project. Please raise your hand if you can't hear me properly. I realize I don't really have a booming voice. I'll try to project a little bit more. Thank you. So to talk about the Refugee Mental Health Project, it's a project that's funded by the Citizenship and Immigration Canada, and it includes 3 prongs. Basically, what we try to do is increase understanding and the knowledge base and skill base of service providers in supporting refugees. We do that through 3 different ways. We have online courses that we've developed, we have a community of practice, and we're developing a toolkit of resources that you can use. And this all comes out of the idea that refugees have different needs compared to other newcomers. Ontario receives about 11,000 refugees per year, and this project is based on evidence. This study here called the Promising Practices and Partnership Building Resources, it came out of that study that said that there are service providers, this is healthcare workers and settlement workers across the country, who say that they need to feel more confident and get more skills and build their communication when it comes to supporting refugees. Our program was a follow-up of the study that was also CIC funded. What that study found, what they did was they interviewed over 150 people across Canada and found that service providers wanted to feel that they could offer more timely and cultural competent support to refugees. The other thing the study found was that one of the essential things to provide good care to refugees in their mental health was to have really good partnerships with other service providers and other agencies. So that's another thing that we're really trying to do with the project, is to allow both these things to happen, the knowledge building, the skill and practice building, as well as the bridging between different types of professionals and different types of agencies. So the first thing that we did was develop these online courses. The courses there's 2 different streams. If you're a healthcare worker, you get the course for the healthcare worker, and there's a course specifically for settlement workers, because you do work in different realms. The one for settlement workers is a little bit more case management based, and the one for healthcare providers includes a little bit more assessment and treatment information. But what they both try to do is have topics relevant to refugee mental health. So the most common types of mental disorders that you might find in the refugee population, how to support different types of refugee subgroups, so that might be children, women, seniors, and the LGBT community, as well as victims of torture, which Teresa touched on. We try to do this through the online course because it's accessible, it's cheap, and you can access it as a service provider any time of the day, from your computer, at home, at work, at night when you can't sleep, any time of the day at all. Hopefully you have other things to do if you can't sleep. I should mention also the courses were accredited by the U of T Continuing Education and Professional Development Office. So if you do work for a profession who's regulated, you can get credit for that. And I mentioned they're online, they're self-directed, it's all original content that we've come up with. We try to find practices that are based in evidence and research. So it's been known to be effective, and we try to make it practical, so practical to your practices in various professions. Just to let you know briefly what the courses are about, in each course there's over 30 videos that we've created and videotaped ourselves professionally, not like me. There's videos, there's over 60 images each module, and there's about 6 or 7 modules depending on which course you take. There's one exercise per module. So we try to make it interactive and interesting. The second thing we offered is the community of practice, and this is an online forum for everyone who's done the course. So if you've enrolled in the course, after the course is over, you're then put into this community of practice. And what it is this online forum where everyone can talk to each other. It's like a big discussion board. But what makes it different from other types of online communities is that everyone who's a member is a practitioner of some kind. So you as a service provider have all this experience of having worked directly with clients and patients of various backgrounds as refugees. So you can share that on this community of practice. And that's what really makes, I think, this project so interesting and valuable to you as a service provider, is that that allows you to have these important linkages between you and other professionals, between you and other agencies, and hopefully between settlement workers and healthcare workers, because they, there is a lot of maybe not misunderstanding, but there's a lot of knowledge sharing that could be done, and a lot of service bridging that could really be helpful to refugee clients. I should also mention we have a panel of subject matter experts who answer questions. So if you as a member have a practice question or a scenario with a client that you need some answers about, you could also contact this panel of experts and get some professional advice. We also offer, it says monthly webinars, but they're actually every 2 weeks on various topics. The last one we had was actually Teresa Drabetsikis, who spoke about providing services to survivors of torture. The third thing we offered is the online toolkit, and this is something that's in development, but hopefully launching this at the end of this month. A lot of people in the community of practice and in the course have said, I'm looking for a Spanish-speaking psychotherapist, or this or that, and hopefully this online toolkit will answer your questions, because it'll have actual resources and tools that you can just get online, print, and use right away with your clients and patients. So there are things like fact sheets that you can give to your clients, tip sheets on how to work with interpreters, screeners for healthcare workers, those kind of things. And it's going to be public on the project website through CAMH, and hopefully you can access that, and that'll be helpful too. So I just wanted to end with our project website. Of course, you can't access the course or the community of practice on our website, but you will be able to access the toolkit on this website at the end of the month. So I share with you this very long URL, which is our website, and I apologize, I couldn't shorten it, or else we'd be off the CAMH domain. However, if you contact me, and there's my email address and phone number, I'd be glad to give that to you. I also brought some postcards and business cards at the table at the back of the room, so please take one, and you can get our website off there, or just ask me. So that's about it for the refugee mental health part.